Hello, my name is Nicole Kelso, and today I will be explaining the impact of trauma. The client that I will be educating about trauma is a 33-year-old Caucasian female. Currently, she is employed as a peer support specialist and is a single mother of a 9-year-old daughter. During the client's own childhood, she witnessed severe domestic violence towards her mother at the hands of her father. This abuse ultimately led to their divorce when she was 7 years old. The client then experienced mental and emotional abuse by her mother during her child and adolescent years. The client began abusing drugs as a teenager, and by the time she was 20 years old, she was addicted to heroin. Currently, the client has been able to maintain recovery from drugs and alcohol for the past 3 years. However, she reports feelings of anger, resentment, and a distrust for others. She also expressed difficulty in maintaining social and romantic relationships due to low self-esteem and low self-worth. The client does not seem to understand the connection between the trauma she experienced as a child, adolescent, her past drug use, and the emotions she is currently experiencing. The client believes that because she was never physically abused or sexually abused, the abuse that she experienced doesn't qualify as trauma. So as her therapist, I'm here today in order to help the client understand a better definition of trauma, what qualifies for trauma, and how trauma affects people. So, according to Rothschild 2010, trauma is a psychological experience that takes a toll on one's body and mind, even when the traumatic event causes no bodily harm. Trauma can affect men and women of all cultural backgrounds. Events that are considered traumatic can be wide-ranging, from the ordinary stuff such as divorce, death, illness, to severe trauma that includes physical abuse, sexual abuse, emotional abuse, or combat trauma. In the case of trauma, individuals can be affected directly or indirectly. Those who are witnesses to or experience trauma indirectly can also become traumatized and have the same lasting physical and psychological effects or damage as those abused directly. So post-traumatic stress disorder, or PTSD, depression, anxiety, and a decline in one's overall physical health are just some of the examples of the lasting effects of trauma. Trauma is defined by the experience of the survivor, meaning two people could go through the same harmful event and one person might be traumatized while the other person could remain relatively unaffected. So not everyone who experiences a traumatic event will develop post-traumatic stress disorder. According to Rothschild 2010, they describe post-traumatic stress disorder as disrupting the functioning of those affected by interfering with their ability to meet daily needs and perform the most basic functioning. The trauma repetitively intrudes with visual, auditory, or somatic reality in the lives of trauma victims. Therefore, it's like they are reliving the traumatic event over and over again instead of being able to put it behind them or put it in the past like an ordinary memory. So when trauma is left untreated, trauma survivors can develop their own coping skills, which can be unhealthy, such as self-medicating with drugs and or alcohol, engaging in risky sexual behavior, or engaging in self-harm such as cutting. Survivors of repetitive early trauma are likely to instinctively continue to use the same self-protective coping strategies that they employed to shield themselves from psychic harm at the time of the traumatic experience. So hypervigilance, disassociation, avoidance, and numbing are just some examples of coping strategies that may have been effective at some point in time, but later interfere with the individual's ability to live the life that he or she wants. So healing from trauma can be difficult because the trauma can never be undone. That experience, once you experience it, you've experienced it. However, according to van der Kolk, 2014, what can be dealt with are the imprints of trauma on the body, the mind, and the soul. Trauma robs individuals of the feeling that they are in control, and the challenge of recovery then lies in reestablishing ownership of oneself. So van der Kolk 2014 also describes this process as involving finding a way to become calm and focused, learning to maintain this calm in response to triggers, finding a way to be fully alive in the present, and not having to keep secrets from oneself. So in order to regain control of oneself, individuals need to revisit the trauma that they experienced. The experienced trauma needs to be confronted, but only after there's no risk of being re-traumatized. And that would be decided upon by the therapist and the client, after several meetings and getting to know one another. They would then decide, when to move forward, how far to push, again, so not to cause more harm and to re-traumatize. So useful interventions that can be applied when addressing trauma include motivational interviewing, cognitive behavioral therapy, rapid eye movement, play therapy, just to name a few. The earlier that an individual receives treatment for trauma, the better that the outcome in preventing lasting traumatic events is. So I hope that you have learned more about the impact of trauma and also some interventions that can be applied towards the lasting effects. Thank you.